It's an exciting time. We've now been looking at immunomodulatory drugs. This is basically drugs like lenalidomide, pomalidomide, and thalidomide as treatment for patients with non-Hodgkin's lymphoma. We've been doing this for about 6 years now. Several of the early phase 2 studies, both as single agents and in combination with drugs like rituximab and other monoclonal antibodies, look very, very promising. And so this has led to recent FDA approval of lenalidomide in in diseases like mantle cell lymphoma. So what's happening in the last couple of years is we have run and now completed a couple large studies looking at lenalidomide's use in low-grade lymphoma. One of those is the RELEVANT study, and this was a large randomized study of 1,000 patients, and we randomized half the patients to receive lenalidomide and rituximab versus rituximab plus chemotherapy. We completed that study about 6 months ago, and I'm hopeful that we're going to see some top-line data probably in a couple years. It takes a while to gather and get all the data in these low-grade lymphoma studies. One of the additional interesting things is that we've learned that lenalidomide probably has a place in other types of malignancies as well as with other combinations. So what we're seeing now, really in the last year or two, is lenalidomide emerge as a partner with other novel drugs. So at our center, we're combining lenalidomide with obinutuzumab. This is a second-generation anti-CD20 antibody. There are groups in the United States combining lenalidomide and rituximab with CHOP chemotherapy in large cell lymphoma. There are some really intriguing data looking at lenalidomide and rituximab in untreated mantle cell lymphoma patients. And this was something, a bit of a surprise. We, in the past, have treated mantle cell lymphoma patients with very aggressive chemotherapies when they're first diagnosed. Things like hyper-CVAD with autologous stem cell transplant, or pretty aggressive CHOP-like chemotherapies. There was a group that completed a frontline study with lenalidomide and rituximab in newly diagnosed mantle cell lymphoma patients. These were elderly patients. And surprisingly, the response rate was over 80%. And at 2 years now, the vast majority of these patients remain in remission. So this kind of suggests that going more in the front line or in patients that are treatment naive with immunologic or modulatory drugs like lenalidomide may be an avenue of exploration that we can do in the future. So it's an exciting time, and with the immunomodulatory drugs like lenalidomide probably have multiple mechanisms, and it's just now that we're learning that these drugs may really be ideal partners with some of the novel new agents that are being developed.